Good afternoon. This is Media Center, Ukraine, Odesa. Today is the World Hepatitis Day, and our current speakers, healthcare workers, will share more details about these diseases in the Odesa region, and they will also tell us where people could be tested. Our speakers are Tetyana Rybak, Medical Director of HIV and Hepatitis Care at the Municipal Enterprise Odesa Regional Center for Socially Significant Diseases, and Olena Kolodenko, Director of the Municipal Nonprofit Enterprise of the Odesa City Council Primary Healthcare Center number 3. Yes, this is how it is called, Primary Healthcare Center. So what is the situation with this disease in Odesa? Virus hepatitis is a significant problem for the healthcare system in general because it is very contagious. There are specifics, and it is rather difficult to test it. And sometimes our population do not pay enough attention to this. Hepatitis B and C are most dangerous. According to the assessment by national experts, around 5% of the population of Ukraine are infected with hepatitis C, and only 3% of these people know about this and have access to treatment. As for hepatitis B, it is around 2%, and only 3.7% of those people have access to treatment. This is a dangerous disease because for a quite long period of time, people don't feel anything, so people do not undergo examination. But then, when hepatitis is diagnosed, it is on the severe stages. That's why early screening, early diagnosis, identification of hepatitis markers, all these things are very important, as this should be provided at the primary level, and the family doctors should be responsible for this, and screening is the function of family doctors. Ukraine has joined the global strategy for elimination of virus hepatitis initiated by the World Health Organization, and we have also adopted state strategy for overcoming hepatitis and HIV and tuberculosis. Envisages the access to diagnosis, to screening, and this year we have purchased quick tests, and now we are waiting for the order of the Ministry of Health for allocation of these tests at primary and secondary level. And when it comes to testing, it should be always accompanied by treatment, because I am an expert dealing with this problem, and I always bring to attention of my colleagues that testing in itself is not a very good approach. The doctors should know where to refer their patients for further treatment. As for treatment of virus hepatitis, the state continues providing services despite difficult times. And in our region, we have enough medication. There are no queues, no lists. All people who are in need of treatment, all patients with hepatitis B and C can get this treatment. They should address to territorial offices in all districts of Odesa region, and people can get full treatment if needed. When it comes to treatment, as I've already mentioned, Ukraine has access to the medication of direct action, which are 95% effective. When it comes to treatment results, this is really an impressive result, and I believe that now availability of such medication in Ukraine is a breakthrough, because until recently we did not have such options, and the burden of treatment was on the shoulders of patients, and we could not support these patients when it came to medication. Ukraine fulfills all such liabilities. The program is there, it is implemented, all the regions have medication enough to treat all this treatment. Olena, could you share some details about examination and screening? It is very important for treating viral hepatitis B and C to identify them on the early stage. Screening and early identification is very important for treating such diseases. All citizens, after signing declaration with their family, doctors can do these tests free of charge. If people belong to risk groups, they should be tested every year. We also try to have mass testing, mass activities involving big number of people to test them. And for example, tomorrow we will have such day in the city of Odesa and in our oblast. We will allocate mobile teams for free testing of people. It will be in Ryshelyevskaya Street, a state humanitarian headquarters near railway station, in Kanatna Street, and also near Odessa State Regional Administration, from 10 in the morning to 1 p.m., that is 1300. All people, if they want, they could be tested free of charge. It will be confidential, and in case of positive result of such testing, people will get information about where to be referred to. Hepatitis B and C. This does not mean that people are doomed. They are treated. They are effective medications, but we need the early identification of these diseases and also qualified doctors that will follow up the patients during the whole treatment process. You've mentioned Kanatna. It's Kanatna 83 near the regional administration building. Yes, and you offer quick testing. Yes, people will know the result right away, and they will be also referred to other specialists. Do you have any information now about the situation with the viral hepatitis among the military of Ukraine? Because as far as I remember, with some forms of these, if people who have some forms of these diseases, they are not mobilized. Unfortunately, we don't have the statistics, but I can say that the number of servicemen, servicewomen referring to us is quite high, so they undergo examination, and sometimes people are not aware about being infected. Over the 6 months 2023, we have treated 2 times more people of the general population compared to the previous year, including the military. More than 1,200 persons have been treated. For the hepatitis C, and the big part of this population is the military. If a person is infected, but the person receives full treatment, the person can continue living full lives, and if people feel good, they can serve, depending on the stage of the disease. And if it is a compensation stage, then people could live their lives, ordinary lives. So thank you very much for the information, for the analysis of what is happening, and hopefully we will invite you here with positive news. Our next briefing will be at 1 p.m. in 15 minutes. This briefing will be of practical nature. We will have paramedics who will tell about bed tourniquets, and there will be some examples and how they can be used in real life. Stay tuned, and it will be interesting.